Hello, everybody. I am delighted to be here to talk to you a little bit about making the most of your health insurance. My name is Monica Bryant. I am a cancer rights attorney by training and Chief Operating Officer for Triage Cancer. For those of you who aren't familiar, Triage Cancer is a national nonprofit that provides education on all of the practical and legal issues that can come up after a cancer diagnosis. And we provide that education in a number of different ways. We have educational events that are all free to attend. Our Triage Cancer conferences are open to individuals who've been diagnosed, caregivers, healthcare professionals, advocates, really anyone who wants to learn more about this. We also have monthly webinars that I'll be referencing today as well. We have some online resources and materials that you can access, and everything's provided free of charge. I wanted to share this with you up front because we only have a little bit of time together today. And I want you to know that even after today, if you have questions about health insurance, employment, disability insurance, finances, we can certainly be a resource to you as well as Zero. So to get into the topic for today, health insurance, there are three places that Americans get their health insurance. The largest number of Americans get their insurance through an employer. The second largest group gets their insurance through the government, primarily through Medicare and Medicaid. And the smallest number of Americans get their insurance directly from a health insurance company. But regardless of where you get your health insurance, the bottom line is it is often very confusing to people about how to use the insurance, the different terms that are being used, and certainly how to pick the best policy for you. So if you feel like you don't understand health insurance as well as you would like to, you are certainly not alone. There have been tons of studies that basically show Americans don't understand health insurance. This particular one found that only 4% of Americans can correctly identify the four most common terms being used in health insurance. So if we don't even understand the words that are being used, how can we possibly expect Americans to be savvy consumers when it comes to picking the right policy for them? So today, the heart of making the most of your insurance is going to start with understanding all the terms and how they work together. So some terms related to costs. We all have to pay a monthly premium just to have health insurance, and we're going to pay that monthly premium whether we go to the doctor or not. But then there are some additional costs that we incur when we actually go to the doctor. And the first is our deductible. This is a fixed dollar amount that we have to pay each year before our insurance starts picking up their share of the cost. Now, deductibles range policy to policy. So you could have a $500 deductible, you could have a $5,000 deductible. But whatever that deductible is, it's what you have to pay out of pocket before the insurance company picks up their share of the cost. Their share of the costs is referred to as cost share or co-insurance. And this is a percentage, and it's the difference between what the insurance has to pay and what you have to pay once you've met your deductible. So if you have an 80-20 plan, once you meet that deductible, the insurance company is responsible for 80% of your healthcare costs, and you're responsible for 20%. Many policies have an additional payment called a copayment. And this, again, is a fixed dollar amount. It's going to depend on the policy itself. It could also depend on the service. So, for example, it's very common to have a $25 copayment to go and see the doctor, a $35 copayment to see a specialist, and a $250 copayment to go to the emergency room. Now, one of the most valuable things for us to understand about our health insurance is the out-of-pocket maximum. And this, again, is a fixed dollar amount that's going to vary from policy to policy. But what it is the most that you're going to pay out of pocket for those medical expenses each year. And the way you get to that out-of-pocket maximum is by adding up everything you paid towards your co-insurance, everything you pay towards your deductible, and everything you pay towards your co-payments. So it's everything you're paying except those monthly premiums. Now, I will tell you, typically out-of-pocket maximums typically only apply to in-network providers. So if you're seeing an out-of-network provider, those costs that you're spending out of pocket probably won't be included. Also, some employer policies might have a slightly different formula to get to that out-of-pocket maximum. For example, they might take out that deductible. So it is valuable for you to understand exactly how your policy defines the out-of-pocket maximum. But to give you an example of how this all works, meet Dan. Dan has an insurance policy with a $2,000 deductible. It's an 80-20 co-insurance and an $8,000 out-of-pocket maximum. Dan hasn't gone to the doctor yet this year, but he gets into an accident and he ends up with a $102,000 hospital bill. What does Dan have to pay? Well, the first thing we always have to pay is that deductible. So he pays his $2,000 deductible and it leaves $100,000 of that bill left. Now his co-insurance kicks in. The insurance policy pays 80%, and Dan's responsible for 20%, which 20% of $100,000 is $20,000. But because Dan's plan has that out-of-pocket maximum, he only has to pay another $6,000. He's already paid $2,000 in his deductible. So once he pays $6,000 of that bill, he's met his out-of-pocket maximum for the year, and the insurance company will cover all of his medical costs moving forward for the year. Now, I am not suggesting that $8,000 isn't a lot of money. Of course it is. But when we start looking at the alternatives of what Dan would have had to pay without the out-of-pocket maximum, or certainly what he would have had to pay without health insurance, $8,000 starts to feel a little bit more reasonable. But the most important piece about this is that it allows us, by understanding the out-of-pocket maximums, it allows us as consumers to plan for a worst case scenario. Now, if you would like to hear any of that again, the terms that I just described or this example, that's included in one of our animated videos called Health Insurance Basics. And it's available in English and Spanish, and you can watch it on our website. Now, I already mentioned the term network a couple of times, but what does that actually mean? Most health insurance policies have a network of providers, and those providers could be hospitals, physicians, pharmacies, labs, and those providers have agreed that by virtue of being part of this network, whenever they see patients with that insurance, they will take a specific amount of money for each service. And so that specific amount of money is referred to as the allowed amount or the contracted amount. I have to tell you, one of the reasons why I think health insurance can be so confusing is that there are often multiple terms for exactly the same thing. And here's one example of that. Now, another term that gets used quite a bit and people don't always understand is prior authorization. Prior authorization at its sort of basic level is the idea that as consumers, we have to go to the insurance company before we receive services and get the insurance company to approve those services. Prior authorization has lots of different names: pre-authorization, prior auth, pre-auth, PAs, utilization management is sort of an umbrella term. The other challenge is that in many cases, people aren't given a comprehensive list of services that says, you're going to get any of these 100 services, you need prior authorization, otherwise you're good. So it can feel a little bit like a guessing game for consumers about, well, do I need prior authorization or not? Another challenge is that many people feel or believe that it's up to their healthcare providers, the doctor's office or the hospital, to go to the insurance company and ask for the prior authorization on their behalf. And while many providers are very generous in doing that for us, the ultimate responsibility for getting the prior authorization is actually on us as the patient. Now, if someone fails to get a prior authorization, the insurance company could deny covering that service. Another significant, frustrating situation about prior authorizations is that even if someone does all the right things and goes and gets their prior authorization, it's not a guarantee that the insurance company is going to cover it. So this is one of the rare instances when I don't really have a great answer for you about this, because really there isn't a great answer. But what I do want to share with you is it's in your best interest to ask your providers if they're going to be getting the prior authorization or if you should, and to be double checking with your insurance company whenever you're getting sort of those big services, MRIs, surgery, etc. Now, when we talk about prescription drugs, there are some other terms that are helpful to understand. Most insurance companies have what's called a formulary, which is really just a list of drugs that the insurance company is going to cover and at what rate, because not all drugs are covered at the same rate. Typically, formularies are broken down into different payment tiers or categories. And depending on where the drug falls in those tiers is going to determine what you have to pay for the drugs. So this is just an example of a common type of formulary. So tier 1 is going to be a cheap generic drug, maybe a common antibiotic that you would take for like a sinus infection. And for those kinds of drugs, you're going to pay $5 per prescription. Then tier 2 is more expensive generic drugs and some preferred brand names. And so for those drugs, $25 per payment. And so on until you get to what's typically called a specialty tier. And this is where many cancer drugs fall. And in this tier, usually it's not a co-payment, so it's not a fixed dollar amount you have to pay, but rather it's a co-insurance. So it's going to be a percentage. So if you have an expensive cancer drug and you're being charged a co-insurance, that could be a significant amount of money. And then if you have a drug that falls what's called off formulary, it means that that insurance company doesn't cover the drug and you're going to be responsible for 100% of the prescription. And the amount that you pay for those off formulary drugs typically don't count towards your out-of-pocket maximum. Now that we have the terms under our belts, it's valuable to understand all of our health insurance options. And there are many cases when people have more than one option for health insurance. And it might be that they could choose option A or option B, or it might be a situation where they're going to have option A and option B, and then understanding how the two work together is valuable. Now, unfortunately, we don't have a ton of time together, so I will just point you back to the Triage Cancer webinar series. We have the recorded webinars on our website where you can watch last year's versions, and then our upcoming for this year is all on our website as well. You can register. And specific to this topic, we will have upcoming webinars on understanding Medicare and understanding your health insurance options. Because when it comes to Medicare, individuals actually have some additional choices to make. So it's not just about, I want this type of drug plan, but we actually have two different lanes that we can drive in when it comes to Medicare. Lane 1 is what's called original Medicare, where you receive Part A for your hospital insurance. Now, typically, if you worked and paid into the system, Part A will be premium free. Then you get Part B, which is your medical insurance. And that's going to cover things like doctor's visits and immunizations and IV chemotherapy. Even if you worked and paid into the system, there is a monthly premium for Part B, an annual deductible, and an 80-20 coinsurance. Now, Part B does not have an out-of-pocket maximum, so you will pay 20% of your medical services for the year once you've met that deductible. Now, because Part A and Part B don't cover prescription drugs, you may want to consider picking up what's called a Part D plan or a Medicare prescription drug plan. These are plans sold by private insurance companies, so the costs are going to vary from company to company. Now, remember how I said Part B doesn't have an out-of-pocket maximum? Well, to cover the out-of-pocket costs for Part A and Part B, you can buy an additional insurance policy called a Medigap plan, also called a Medicare supplemental plan. And these plans help cover those out-of-pocket costs, like the 20% you pay in Part B. So that's original Medicare lane 1. Lane 2 is an alternative because it turns out keeping track of potentially 3 different premiums and deductibles and co-insurances is a lot. So Part C, otherwise known as Medicare Advantage, is the alternative. And these are managed care plans that are sold by private insurance companies where they're going to bundle all of your Part A and Part B services under one umbrella. About 90% of Medicare Advantage plans also include prescription drugs, but if you pick one that doesn't, you can also pick up a standalone Part D plan. And that's where your options end in lane 2, because Medicare Advantage plans come with an out-of-pocket maximum. Now, that was the fastest review of Medicare possible. So if you have questions, I strongly encourage you to check out all of our Medicare resources on triagecancer.org. And you can also certainly contact us with questions. So what's great is that as consumers, we have more health insurance options than we've ever had in the past. But now the question is, how do we actually compare those options to pick the best plan for us that's going to minimize our out-of-pocket expenses? So I'm going to walk you through a quick example that works whether you're trying to compare 2 plans that you purchase in the marketplace, whether you're trying to compare 2 plans offered to you through an employer, whether you're trying to decide, well, do I take my employer plan or do I go buy a marketplace plan? Or even if you're trying to compare 2 Medicare Advantage plans. So I'm going to use the marketplace, but the same analysis works for all of these scenarios. Here we have a situation where there's 3 different plans. Bronze has a $173 deductible and a $6,000 out-of-pocket maximum. The silver has a $271 monthly premium and a $5,200 out-of-pocket maximum. And the platinum with almost a $400 a month premium and an $1,150 out-of-pocket maximum. So assuming that I'm going to hit my out-of-pocket maximum, which is many times a safe assumption in the cancer community, which plan is going to cost me the least at the end of the year? In reality, there's no way for me to tell just by looking at this. I actually have to do the math. And the way that you do the math is you take that monthly premium and you multiply it by 12, because that's how much you're going to pay in premiums for the year. And then you add the out-of-pocket maximum. And when you do that for all 3 plans, you can see that that expensive monthly premium platinum plan ends up being over $2,000 less expensive at the end of the year. Now, it doesn't always turn out this way. We do this all over the country, and depending on the different plans that we pull, it could come out differently. But the point is, there's no way to figure out which is going to cost me the least without doing this math. And oftentimes people will get sticker shock and think, well, why would I pay $400 a month when I can pay $173 a month? But without doing this math, they could end up paying a lot more at the end of the year. But that's not the only piece of the puzzle. Also, look at that platinum plan deductible. That means that that policy starts picking up 90% of that person's medical costs on day 1. Whereas in the bronze plan, someone has to write a $6,000 check before the insurance company picks up anything. So the other piece of this is to understand, for some people, it might be easier to pay even twice as much each month rather than trying to come up with a big lump sum deductible. But of course, cost is only part of the equation. Remember, I said those out-of-pocket maximums typically only count payments made towards in-network providers. So before picking a plan, it is imperative that you check that your doctors, your hospitals, your pharmacies, your labs are covered under that plan. Also, making sure that the prescription drug coverage meets your needs, in that the drug formulary of that plan covers the drugs that you are taking. Now, typically we are picking an insurance plan for the year coming. And so as treatments change, you might not know every drug that you could possibly be taking. And so it's helpful to ask your providers, do you anticipate that my drug needs are going to change in the next year? There are sometimes standard courses of treatment for certain medical conditions where it's pretty clear that for the next year, you're going to take X prescription drug. And talking to your providers about that, although there's no crystal ball and it's not a guarantee, it can just be helpful, again, as a savvy consumer to take that extra step. Now, I know that that was a lot in a short period of time. So rest assured, we have resources to be helpful, including an animated video on picking a plan that walks through some of the things I just talked about. And we have 2 worksheets that can be printed out from our website. We have one that will help you actually do the math for private and employer-sponsored insurance. And we have the same one that helps you do the math to compare with Medicare, which lane 1 with original Medicare or lane 2 with Medicare Advantage is going to be the best for you. So feel free to take a look at our health insurance topic page on our website, and you'll find all of the resources that I'm referring to right now. But here's the thing, even if you get the best health insurance possible, there are still going to be out-of-pocket expenses. And so how do we deal with those? Well, once you receive care, you could get multiple pieces of communication. The most significant is going to be the explanation of benefits from your insurance company. And this is just an example of a common explanation of benefits. There's going to include some information about who the policyholder is, who the patient is, the summary. There's going to be dates and some numbers. Hopefully, good EOBs even have words explaining the services, but if not, many CPT codes are Googleable now. And certainly if you don't know a service or understand, like, I don't remember what I got on that day, talking to your providers. The EOB is also going to explain how much the insurance company is paying and how much you're responsible for. The telltale sign of an EOB is that somewhere in big black letters, it's going to say, this is not a bill. Now, in addition to the EOB from the insurance company, you're going to actually get the bill from your provider. The hard part about this is that this communication doesn't always come in that order. Many times providers are faster at sending you the bill than the insurance companies are at processing the claim. And if you just pay that bill before you've seen the EOB, you actually might be in a situation where now you have to try to get money back from a provider. So the general rule of thumb is to wait until you receive the EOB to pay the provider. Now, this should not happen in a vacuum. You should absolutely communicate with the providers. Hey, got the bill. I see the due date's coming up. I haven't gotten the EOB yet. Can you push back the due date or make a note in my file so that they know the reason you're not paying is you haven't gotten that EOB yet? Now, I mentioned there's going to be codes you can Google, maybe even some words. It is so important to review your bills for accuracy. Medical billing is a human process, and humans make mistakes. We've seen some crazy things like people being charged for 11 surgeries instead of 1 because the 1 was accidentally hit twice. And so looking at those EOBs, making sure that you actually received all of the services that you're being billed for is very helpful. We recognize that that can be a lot to do on your own, particularly if you are in the middle of, active treatment. And so there are professional bill reviewing services. We have a partnership with one of those called CoPatient. CoPatient will review bills to look for mistakes. They will help with appeals in some situations. And then if needed, they can also help negotiate payment plans on your behalf. Now, typically, CoPatient charges for these services, but through our partnership with them, they are providing Triage Cancer constituents, so to speak, with 1 year free of services. So if you go to this triagecancer.org cancer medical bills website, you can follow the links to sign up for those services. If someone is in a situation where they've received services and the claim gets denied, as consumers, we have the opportunity to appeal that decision. So we don't necessarily have to take no for an answer. I will say the details about appeals are going to vary based on the type of insurance that you have. So have you purchased through the marketplace, or do you have Medicare? The details are going to vary. But generally speaking, this is the opportunity to go back to the insurance company and provide them with information and evidence that the service you received should have been covered. Now, it could be that, it was just a mistake, the wrong code was put in, or it could be that the service is being considered experimental or investigational. And in that case, you're going to want to gather information about medical necessity, which is the legal standard. Generally speaking, we have at least 2 levels of appeal. So one opportunity to go back to the insurance company itself, and then one opportunity to go to an independent entity, and this is called an external appeal. Now, there are lots of challenges with the appeals process, but one of the most significant challenges that we see is lack of knowledge, in that we know patients are rarely appealing these denied claims. And when we talk about how to make the most of our health insurance policies, this appeals process is a critical component of that. So I certainly encourage you, if you end up with a denial, to talk to your healthcare provider about appealing and check out all of the resources that we have on appeals to help you with that process. So in summary, to make the most of our health insurance, we not only have to pick the best policy for us, but once we have that policy, making sure that we're using in-network providers whenever possible. We're asking for those prior authorizations when necessary. We're paying close attention to the bills that are coming in so that we are actually only being billed for services we receive. And then leveraging those out-of-pocket maximums. So by understanding those out-of-pocket maximums, if you've met it for the year, think about what other services you might need. So have you been putting off that knee replacement that you need? Maybe this year is the year to do it because you're basically going to get it for free since you've already met your out-of-pocket maximum. Now, I am not suggesting that people get medical care they don't need. The point is, by understanding this process, we can make educated decisions. The same is true for timing. So if someone is considering delaying treatment for a few weeks and now the treatment is going to end at the beginning of the following year, they're going to end up paying more for that treatment because now they have to meet their deductible and meet their out-of-pocket maximum again. And then finally, as I just shared with you, if you receive a denial of care, make sure that you are appealing that denial. So I am so grateful to have the opportunity to be here today to talk to you about making the most of your health insurance, but I certainly hope that this is not the end of the relationship that you have with Triage Cancer. We're so fortunate to have Zero as a partner. We welcome you at our events. Certainly, if you'd like to take a look at any of the materials I've mentioned, those are all available on our website. And if you'd like to stay up to date with late breaking news in the areas of health insurance, employment, disability insurance, estate planning, and more, feel free to subscribe to our blog and get those updates in your inbox. So thank you so much and have a wonderful rest of the conference.